My name is Logan La Roue, and I've called White Rock home since 1994 when my family and I moved up here from Georgia. When I think about growing up here, I think about days spent down at White Rock Pier, the schools that I went to, the lovely trails that we have, and I also think about Peace Arch Hospital. For years, I experienced a pain and numbness in my lower back and right leg. It went from being just a dull ache and the occasional loss of sensation to overall excruciating pain that affected every area of my life. I had talked about it with my doctor. I had seen a massage therapist, physiotherapist, chiropractor, but it just kept getting worse. There needed to be a way for the doctors to tell me what was actually going on inside my body with medical imaging so that we could start finding a solution. When I went for the MRI, it was around 4 a.m. The MRI is operated 24/7 and the wait lists are so long.
There's only 20 spots. We get 40 to 50 requests. It quickly starts to build and build and build. And the imaging isn't quite as good as it was a few years ago. It does run into issues where, at times we've had it go down. We don't have that many MRIs for our population.
The day after, my family physician gave me a call early in the morning, which I wasn't expecting because I thought it would take a little bit of time. And so I sat down and she told me, I don't want to freak you out, but you have a large tumor inside of your spine. I was connected with a neurologist at a specialty spinal center. He was surprised that I was still walking at all. I was told that I needed to go into emergency surgery as soon as possible so that we could have a chance at preserving these important nerve functions. I was honestly even scared to walk around anymore because I didn't want to damage my nerves or do something that would cause more pain or make it harder for them to remove the tumor. My surgery was around 11 or 12 hours long. I woke up by myself, and it was honestly the scariest time of my life because I didn't know if they were able to remove the tumor or if they found anything else or if they accidentally clipped one of my nerves, if I would be able to walk again. I had to learn to sit up and eventually stand up. I had to learn to walk with a walker, and I had to eventually learn to walk without it. As a young woman with your whole life ahead of you, you envision getting married and having babies, and knowing that that experience may have been taken from me is a really hard thing to think about. I have to look back with feelings of gratitude because I was able to receive my diagnosis at a critical time. There are many people who did not receive a diagnosis when they needed it, and there wasn't enough time to save their life. And then I have fear because I know that there are people still waiting, and I hope that our community will step up and help fund this new equipment.
The reason that a new MRI is urgent is because a new MRI will allow us to make more accurate diagnoses that can be the difference between life and death for some patients.
Time is so precious, and so are their lives. I was given time.